So today I would like to cover with all the important topics in environmental health, and then next following chapters you will be talking about the healthcare system also and what is possible to do about that. One thing also what you were probably able to realize through the presentation is that this profession of public health, it will be always open jobs for that. So it looks like if you decided for this great profession, there will be always a need. It's based on that challenges. It's never-ending process, so it's always necessary to be involved in improving the health for the population and improving the quality of the population. So you can see all of that sections. So it looks like there will be always call for more and more public health professionals. And I know I'm still returning a little bit back to the presentation because I was really impressed with that. As they mentioned, education. Yes, education is very important. So you can see it's like very, very important that public is educated because there are many, many important basic things. Another what needs to be together with education is resources. This is something what you learn more in public health too. So I need to do as a public health provider education, that's the basic. But if I do the education, I have to try somehow to provide resources. And you are probably thinking, what is that resources? So it means even when we talk, for example, about nutrition. So if I will be recommending this type of nutrition is important or healthy fruits or vegetables to eat, I need to also arrange that the people can get that. They can buy that. There are the stores or there is social economic situation that they are able to get that. So if they are educated, I have to simultaneously to take care that somehow they will be able to get the resources for that. They can apply the education. They can apply completely the knowledge what was told to them. So all of that situations or things are very important to be together. So now we are with the clean air, if it's safe or if it's not. If you can remind me, did you see this table or you didn't see that table? Because I see that all the time from PubHlth1 classes, and so I just wanted to share that with you. Another very good news I wanted to share that with you, and you already know that you are part of this class now that we are doing the videotaping and we talk about the education. So because there will be two possibilities how this class or the public health education will be available for maybe future public health providers or just for people that they would like to educate themselves about the public health. So there will be the two forms. One, it's called like Coursera, so that you can see all that topics and presentations. And then it's another form that also there will be some challenges and people that they will be or students or anybody who will be taking this class could also have communication with other people in the whole world. So just the news that I'm sharing with you now for that open education about PubHlth1 class, we have almost like 7,000 people in the whole world. So can you imagine, but it must be different structure of the class. It must be done like a discussion forum. So imagine that you will be online and doing the discussion forum with somebody who already lives in some area in India. And now there will be some discussion questions, how they are dealing that, how they would like to solve that. So that will be amazing, again, experience through that education and through that view maybe from other people or from other students from different locations and sharing that how this is done here and how this can be done in other places. So eventually, if from this will come new future public health providers or just having as an education for the public, so that can be tremendous things about it. It's really like teaching the whole world, yes, and improving the education as quickly as possible and without almost any limitations to go to all of that places in the whole world. So I just wanted to share you that part that you are actually, the whole class, it's part of this process. So I will be a little bit telling you more at the end of the course and sharing additional information with you, but this is the basic one. So now we are in the environment. So this is Chapter 20, so clean air, is it safe to breathe? And I was just talking with some of my friends in Czech Republic, and they told me, well, they are asking always like, what is the air here? Is it fresh? And people have a lot of respiratory problems, or what is the situation? And I just told them, well, I'm always, when I'm letting two students to go from the class 5 minutes before the ending, I tell them, please breathe the fresh air, because, I mean, it's amazing. We are really, you know, we have the fortunate things with public health infrastructure and with different type of the public health policies that we can have that fresh air. And I will be going through the slides also when I will be talking a little bit more about Czech Republic during the communist system and still what are the problems now. So air pollution, to have the fresh air and clean air, it's very important for that good quality of life. The same like you need to have good, you know, you have to have clean water, you need to have the clean air, because otherwise, if it's not there, you immediately notice that, and it's a higher occurrence of the respiratory diseases. That was 2011 when I was traveling with UCI students for the summer travel program. So we were during the summer months, that was the winter months in Chile. And so in Chile, again, it's the process of inversion. There is not enough of public health policy to keep the manufacturers, to keeping the filters, to keeping, you know, the specific amount that what is allowed and what is not allowed to get to the air and doing the pollution. So it's just like almost everybody there has problems with respiratory diseases. And of course, many of the students got sick, including their instructor, that was me. So I have to go to the hospital also there, or the medical facility, to have the treatment for the respiratory disease problem. So I was surprised that everybody there, children, everybody was having problems with respiratory diseases. So even if I'm taking my own medication in the form of garlic and vitamins and everything, still it was not possible to work completely with the air pollution what was done in that time. And there was additional also that was quite surprising. It happened on Sunday. Suddenly in the Santiago, in that capital in Chile, was like the black cloud. And so we were just wondering, what is the black cloud? And then we learned in the newspapers Monday, just by the way, there was the fire in one of the plastic, well, that was the factory that was producing the plastic products, and there was the fire in that. And so they were just giving information to the public, don't worry about that, there it's not no hazards to the, you know, to the public there. But this information was coming from the newspapers, and there was immediately coming information from the researchers from the university there, giving the awareness that it's not like that, because there were a lot of particles from that plastic components that could eventually be sitting there and having some effect of the respiratory diseases. And of course, it was like that. But because there is not completely the proper way of the public health infrastructure developed there, there is still not completely done in the proper way the public health policy. So it was, I was quite surprised, because this situation was described just one time in the newspaper, and just one comments, you know, from the university. They wanted to more comment it about that, but there was no additional space the next day to talking about that. So I was thinking, if situation will happen in United States, in California, so that will be probably discussion for a long period of time from different public health policies, that agencies, and you know, checking and doing the measurements and everything like that, which is very important to do that. So if you see that it's quite connected, here you see some challenges in the future. Connection of public health with the level of the government also, how government is approaching different situations. So that was quite, it just disappeared like that, and people have, you know, higher occurrence of the respiratory diseases during the time, because actually in that time it happened to me that on that Sunday I was walking more. I wanted to do more exercise because all the time I was in the classes and teaching. So I spent probably 5 hours on that Sunday walking, and then I was immediately sick the next day after that, which I assume that was, not assume, I think that was connected with this higher risk of the pollution. There was no information, like now you can see that is immediately the levels like you should be inside, indoor, or if there is smoke, or its information is given to you through the emails, through the newspapers, also on the website. Nothing like that existed there. So imagine now in case there will be really, like when I mentioned about the Coursera or some, public health classes, if student could be, in that location and communicating with some of the topics in public health class that is like online with other students from other area, so they probably can share that information and they can tell them, well, how it was, what is the dealing with the situation. So they will realize, well, we have to do something about that too. But also you have to be aware that people are probably not traveling so much from many of these countries. So how they should know, like, oh, this can be established. So this possibility like that, it's amazing things for the future, not just for the education, but for getting the resources and educate public health providers. So this is the table that I wanted to show you that, yes, sometimes we are thinking, well, air pollution, but the components in the air could have not connection only with the respiratory diseases problems, but also on the skin. Also, it can be additional later reactions, maybe development of the cancer, maybe development of the problems with the formation of the bones, maybe some form of asthma, eczema, so many different things. If you look on that table, what you are probably surprised and seeing, mostly there are a lot of countries that in the past they were under the Soviet Union, under the communist system. So unfortunately, until like 1990, that was starting almost from 1945 after the Second World War. That was actually the communist system in many of the countries in Europe was under the Soviet Union regime. So there were not, I mean, the government was not supporting to have any public health policy, or was not even, sharing that information with other countries outside of the communist system. So that was something happening, and it's still the problems there that now after the 1990, many of that other countries would like to show the help to the former communist countries to help them with public health policy, help them with establishment of different filters or anything that can be done to minimize the pollution. But of course, it's other countries have the problems too. So if you look on that, so it's very, very important to take care, of that pollution. So this is the personal experience inversion from Czech Republic. I just don't know now which one will be working, probably this article. This is actually, now you are learning from the city where I was born. The city, it's called Teplice. And so I was born in this city, and this was the city with the high inversion, so it's like valley. And in the not far from that city, there was the industry. It's heavy industry, especially like the coal mining. And we will learn later, like what are the old products that are dangerous and they are causing the air pollution. So in that time when I was still as a student at medical school, so we have actually like 2 months to do the practical part also in the public health. And all the data about talking and correlations with the pollution and with diseases, they were like classified. So you didn't have access to that. You couldn't see that. So it was always telling like, oh, everything is fine, everything is fine. In order to keep people in that area, especially young population, so what the government was doing in that time was giving incentives. So they tried to keep the people people in that polluted area, because sometimes people have to move there because it was hard for them to live there because of that breathing problems. So they were giving, for example, if you think about that, like somebody will be giving you like $2,000 per year per person in order to live in that area. So young population, young people, of course, if they have small children, they were thinking, well, we will need to start a family, so we will move there, because it was the air, they didn't see that. And they were thinking, well, it cannot be so bad. And because they trusted the government, because they didn't have any information from outside of that country, so they were thinking, well, the government is doing everything what's necessary to do, so it will be like the minor problems with the diseases. But this article came actually after 1990, that was the end of communist system, realizing there were already problems. There were already problems with bone structure for young population. Also like chronic conjunctivitis, respiratory problems. They did little bit programs at schools that they tried to move the children for like 3 weeks or 6 weeks per year to different areas in the Czech Republic. They called it like the schools in the nature, in order to help the children to clean a little bit their respiratory system. But again, it was not everything what should be done. So I still remember when I was living there to have like chronic conjunctivitis. So you have like, especially during the winter months when was the inversion, so you have that problems like that. People try to go a little bit to the mountains to have the fresh air, but there was the problem. So now, so that was a little bit story to get you interested and realizing like how important it is to have the clean air. So criteria for the air pollutants: particulate matter, sulfur dioxide, carbon monoxide. This is something what your classmate mentioned, that nitrogen oxide, ozone level, and lead. So if there will be questions on the midterms, this is something that you definitely need to know, all of these components. When we talk about particulate matter, what you need to know, it's very important now changing the standards, because in the beginning they were thinking, well, if it's the size of the particulate matter, and they made the classification like 10, so they were thinking, oh, if it's different, if it's smaller, there is no problem with that. Yes, they found out actually now it's changed that, new standards, because they realize if they are smaller, it's very difficult to get that and clean that through all the defense system that you have in the respiratory system to get it out of your body. So imagine if some of the particular matters are connected with additional harmful toxic components, and you are just breathing that on the regular basis, and it's staying in your respiratory system. So this is very important. So that's one part that is connected with that. Sulfur dioxide, mostly it's connected with irritation and is the higher risk of the acidity. So this is something really doing the irritation from the sulfur dioxide is also chronic conjunctivitis, so inflammation in your eyes. And so acidic rain on its own, you saw also the table showing that could be the risk on the skin also, irritation on the skin. Nitrogen oxides, again, mostly all of them, of course, it's connected what is happening with the whole the air on its own. The acidic rain, it's a higher risk on that, and also additional like global warming and all of that indirect negative effects of the whole situation that you were able to hear during our guest speaker. Ozone level also, it's all of these that air pollutants are connected with respiratory system. When we talk about that and thinking like, oh, it's pneumonia, it's bronchitis, it can lead also to development of the cancer. And because sometimes of that situation indirectly, it can be connected with cardiovascular diseases, because it's stress situation, increasing blood pressure, and increasing risk of cardiovascular diseases. Lead lead, we already talked about that on its own separately as a hazardous material. And so this is again from different manufacturing and also from the motor vehicles. It's the problem, the lead that is there and could influence the air pollution. This was actually very nicely also explained from your classmates talking about the India. So now if there is the overpopulation there, and that will be the, quite common to have the motor vehicles there. What will happen? Do they have already control for the level of the lead in the gasoline? So that the situation that is controlled in and standardized in the United States or other Western countries. Other air pollutants. So if we look on that different, components like benzene, arsenic, mercury. So even when we talk about tobacco and we are thinking like, it's increasing the risk for addictive behavior on its own because of the nicotine as a component in cigarettes. But the burning material, there are a high amount of different toxic components that some of them are, of course, carcinogenics, but some of them are influencing the other system in the body. So these were just like examples of the air pollutants. This was the strategies for motor vehicles. Because of that changes and because of that recommendations, the smoke was decreased, and there are big differences now what is the air freshness or the being like clean air to compare before this public health policy was established. You can see also like public transportation, encourage carpooling, so decrease a little bit the, not to have the standardized process on the level of the gasoline, what are the components there, but also the use less and less. And, if I was quite, I was just like my face was using the smile, or I was smiling when I saw more and more students using the bicycle, coming to school or walking, or that's also great how the campus is established in the way to use less the cars to come to the school, especially of course if you are living on that campus. Strategies for industrial sources. So that's another thing that you as a public health provider, and if you are in environmental health, you need also to check with companies if they are following the public health policy that are connected for the specific product that they are producing. So that was the good news that I mentioned to you before. Now about the indoor air quality. So realizing that, believing or not, it's also very important how you keep your air healthy inside the place where you are living. So when we talk about the deodorizers or different artificial components that you are using at home, so this is again, think about that. If you read the labels, you realize yes, there are a high amount of chemical components. So if you would like to change it and you have to have nice smell, the best thing will be to use the natural components. So you can use different type of the plants or natural oils, that essential oils that can properly work. They can do stimulation, they can do relaxation. They are the natural essential oils. Extract from the seeds, extract from the plants, and they making the nice smell in the room to compare with the synthetic part. You also need to be sure what could be the pollution. It's of course tobacco. So this is another, we call that like the tobacco, it's like the tertiary effect of the smoking of tobacco, because the smells and that components are staying in the walls and staying in the furniture. And sometimes, that like the new carpets, to be sure what kind of components are inside the carpets. So it's very, very important to open, to ventilate the inside your houses or inside an apartment. So how many of you have quite often always the open windows? I would like to see more hands. Okay, so it's very important. I mean, if there is not any alarming things that you need to close your windows because during the summer months when it's the fire in the proximity, but otherwise, if it's the fresh air, it's very important. It's the best way to clean your air inside your place. We also, I already mentioned about the formaldehyde also, that could be connected sometimes with the new products that you are buying and having that in your inside your apartments. So yes, air fresheners. So how many of you are using or somebody who is using air freshener? Just like that. Okay. So please check the label and check the structure, the chemical names there. And realizing, and especially now they have some specific type of air fresheners that you can put that to the electricity, is that right? So it's something good like forever, constantly. So these are the toxic components, not toxic in the way that, but it's something that you are polluting your air, and it's not toxic in the way that immediately there is any reaction, but if you do that constantly, it's something that is, it's synthetic form that is influencing, your air. So if you would like again to have any form of the air freshener, you should be probably using the essential oils, because then it's really doing like relaxation or stimulation, and it's the natural components, it's not the synthetic form. We already talked about the global effect of air pollution, so therefore it's necessary to develop the specific initiatives and acts and protocols also in order to decrease or improving the health of the air. So this, in case some of you will be involved in environmental health, this is amazing tool. It's the PDF form, and this was done through the whole state of California to check different levels of the quality of the air. And so what could be the resources? What are the points that eventually can influence to have the healthy air or not healthy air? So that was connected with the air pollution, and if you think about that, I hope that you will decide to have the air, it's the same like we need to have the clean water, we need to have the clean air. This is just the basic for a good quality of life, for surviving for the human beings, and minimize the risk of any type of the diseases. Remember also another thing is, if there is the air, it's not completely healthy and it's polluted, it's very easy environment for viruses and for pathogens to invade the human body, because the immune system is already dealing and defending the body against the toxic components in the air. So you get more tired, you get weak, and you develop the environment that is easy for invasion of viruses or other pathogens. So be aware about that. So I have few more topics to cover under the umbrella of environmental health. One is the garbage. So did you think this is also we take that as a standard. You almost know that maybe every Friday or every Monday, you just put your garbage out and you don't know what's happening with that. It's just clean. It's constantly clean. If you travel to different countries, you will be surprised. Sometimes the garbage is just staying, on the streets. One time when I was traveling, I was in Dominican Republic. So they have the garbage is there for 2 weeks. So every 2 weeks only, they are taking the garbage out. So you can imagine what's happening on the streets. And in case there is really rain and there is the season and it's strong rain, so what's happening and what was actually happening in that Dominican Republic in some of the cities, that the garbage, because of the rain and a storm, so it was going down, because if they have little bit hills, so all of that garbage was going down to the main, streets in the city that they were, in that middle of all that mountains around them. So what can happen is that from different areas you get the garbage and you don't know how you got that, but it was from rain or from other storm. Another thing is that I was quite puzzled what I was able to see. And it was also it was actually happening in Guatemala when I was traveling there. So when you go to the forest, you are surprised. There is like note written that you shouldn't use your garbage. This is not place for the garbage, because what sometimes people are doing, because sometimes they are not taking the garbage for 1 week, 2 weeks, 3 weeks, and so people don't know what to do that. And if they have small houses, they don't want to have the garbage next to their house, because if it's not connected with my house, I'm not interested about it, but if it's connected with my house, I'm aware about that. So they put it in the car, going to the forest, and just dumping that there. So it was like in Spanish, like what, no basura, or was written there, and I was like, why is that? So I remember I took also photos of that, because this was quite unusual. You don't see exactly this, in the United States. You don't see that if you go to Mont Balde to see like, don't put your garbage here, because it's the system, it's the public health infrastructure, the system that every Friday you just, you even divide what is like reuse again and what is the garbage on its own, and you put it outside and you just pay. I mean, actually, if you think about that, for that service, it's paid very little. It's like 30, well, I know at University Hill, so every 6 months you pay only $34 for this service. And this is amazing thing. I mean, people are not realizing like what to do with that, with that garbage every day or every week we have. So just observe, based on this lecture, how many times or how many of different bags of the garbage you have, maybe every day or once a week. So this, before 1970, again, you can see there are specific regulations also, or the form, how to deal with the garbage. So it was the open dumps. So this is something what was happening, or you can see sometimes in different developing countries. Also, what I saw is the burning. So sometimes people don't know what to do with the garbage, so they just burn that. But imagine if they are the plastic bottles from the milk and everything, and they put that on the fire and they are burning that. So you already know, well, they are burning that. They would like to have no garbage around their houses, but there is the pollution in the air immediately, toxic components, and you can see that quite often in developing countries. And sometimes it's written there like it's not allowed, it's forbidden. So in some countries, this is already, it was passed that it's not allowed. And another thing is, of course, when we talk about rivers, lakes, so some of the garbage was going to that area, and you already were able to hear the great presentation about what's happening with the pollution of the water. Sanitary landfills, so therefore it was very important to establish the landfills where all of these garbage will be going, but also in order to develop and having specific landfills that you have to be sure that it's not going some of the components through the soil or the soil system, water system to the vicinity, or going to different areas that can have negative impact. So there are the specific public health policy rules telling that how the landfills should look like and how far they should be from different areas where people are living, and also for how long, and if when it's covered and it's the landfill it's actually full. So if it's possible that it can be built something on that. So that's also another specific rules about that. Alternatives to landfills, please remember this one, it's 3 times R. What is that? Reduce, reuse, recycle. So this is like your slogan for public health, how to deal with the garbage, how to decrease the amount that you have as a garbage. So reduce the amount that you are using that. And you probably noticed that, especially I saw many students also just cross the street from UCI, there is the Trader Joe's. So I saw that many students are there and they have their own bags, or you can see like now you can buy that very nice bags that, you know, it's reuse. You are going again and again. So in the beginning, it was like thinking, well, we can save the forest not to have that paper bags. Then was the plastic bags, but now you are thinking, well, we can decrease the garbage if we are not using that plastic bags, but we are reusing that. We have the nice bags and going with that for the shopping. If some of you traveled to Europe, especially in Germany, if you are going, and you probably notice, mostly people are always going with their bags to do the shopping. If you forget your bag, you don't have that, of course, they have the plastic one, but it's very expensive. It's going from €1 to €2 for one of that shopping bag. So imagine, especially like sometimes you are in Albertson and you don't have the bag and they are giving you, you know, you have probably 5, 6 of the bags. So that will be additional, probably €10, which will be like an additional $20 almost, you know, just for the bags. So they try to make that quite uncomfortable for the consumers. That, you know, and also they do education. So it's combination. It's combination of the money and combination of the education. Of course, the education will be the best. You know, that voluntarily basis, people will be going with their own bags and getting that products. But as we know, we sometimes need to establish some kind of either public health policy or some additional the ways that we can support the level of the education. So that's the reduce, that's the reuse also, and recycle, so that we can, you know, doing the recycling, and you already are familiar with that, like the glass recycling, and also at the UCI you already have the different containers that you know which type of that garbage is each of the container. If we think about reduce, I don't know what are the recent statistics, but a couple of years ago it was like Japan on the first doing with reducing. So they were just really trying to minimize the problems with and decreasing the garbage. There was a few years ago was also one person got a little bit famous in that time because he decided to collect all the garbage for 1 year in his home. So he had like 2 or 3 bedrooms home, and apartment, and this was, of course, this he just everything, and he realized that during the 1 year you can completely have the garbage, like, which can represent almost like 2 or 3 bedroom apartments. So if you think about that, we have here 100 students and each of you will be doing something like that, and it was only one person, it was not the family. So we really have to think about that. We completely are not aware about it because it's hidden. We don't see that. It's just the car coming and taking that and it's gone. So, but when we will be talking more, and your classmate mentioned about the increasing the population, what this will be, how we will be dealing with that. So you already, that information what was on the previous slide, you were already able to hear that from our guest speaker, then he was talking about this. Superfund, so this is again, there was the specific acts developed, like what needs to be done with the garbage, the specific cleaning up of the waste sites, and also increasing like the tax on industry that, or they are also paying the penalty. But again, if you think think from public health perspectives, we don't want only that they will pay the penalty. We would like that they are really educated, they are aware about that, and they would like to do something good in that way. They would like to decrease the pollution of the air, or they would like to decrease the pollution of the soil and everything. So we have to use some kind of penalty for that, but the best thing will be that the companies will be really aware and conscious about that problems. Your guest speaker also mentioned about the Environmental Protection Agency, EPA. So this is something that it's really very important that we have that, and they are trying to do, they are as a main course in developing the initiatives about clean environment. So when we talk about the coal ashes, so that's another thing, like how to deal with this. So how we can minimize the byproducts. Not in my backyard. This is something what I mentioned to you already. So if it's outside, it's not like concern, but we have to, from public health perspectives, educate the public. That is very important. That it's not possible to dump the garbage to the forest, because then the forest will disappear, and we need to have that area for having the fresh air. So, discussion question 1. Estimate how much solid waste you generate in a day. How can you reduce the volume of this waste? So, what do you think if you estimate? How many times you have to go with the bags or something to going to the container? How many times are you going per week, probably? Are you going a couple times or once? Oh, I can see like maybe more than once. Is it right? Okay. So, is there some way that you can maybe minimize that? Yes, yeah. Yeah, you think so?
Compost?
Yeah, okay. That's one thing, yeah. Any other things? That will be because, what will be like, yeah, that will be probably one thing that we can, think in that way about that. But also, one thing you can do, going with your bag when you go for the shopping for the food and everything, so you are decreasing that. But even do you remember when I was asking you also to have your papers as a hard copies, and I told you, yes, of course, you can use used already paper. So if one side is fine and one side, so that's another thing that can be, you will be conscious about that. So, sometimes you can wash the dish instead of using all the time of the paper. So that's another thing. So there are maybe many things that you can do about that. Okay, so I know time is going soon in the way that it's usually I'm letting you to go to have the fresh air, fresh breeze, and I'm letting you to go under one condition. Do you remember that? Smile. Okay, so can I see that? I don't see smile on every face. I don't see smile. Yes, please, smile. Okay, yes, thank you. And enjoy, be happy. Don't worry for the fresh air. Do some physical activity, and I will see you on Thursday. We will finish the environmental health.